Hi, I'm Meris, and in this video I'm going to be talking to you about the lab value prostate-specific antigen, or PSA. I'm going to be following along using our lab values flashcards. These are available on our website, leveluprn.com, if you want to grab a set for yourself. Or if you are more of a fan of digital products, I would invite you to check out Flashables, the digital version of all of our flashcards available on demand and at your fingertips wherever you are. All right, let's go ahead and get started. All right, so first up, let's just talk about what PSA is. PSA is a protein, it's an antigen, so it's a protein that is produced by the cells of the prostate. It's a totally normal thing to exist. It's just that we need to make sure that the levels are within the expected range. And the expected range for this lab value is going to be less than 4 nanograms per milliliter. So just a small amount. And again, remember the prostate is a small piece of flesh. It's not a really big deal. So we would expect it to have that kind of small value there for our expected range. Now, what if we have an elevated PSA level? Well, this doesn't really tell us what exactly is going on. This tells us that we need further evaluation. So there's a couple of things that could be going on in somebody who has a prostate and an elevated PSA level. Of course, our big concern is going to be prostate cancer. And typically that is why PSA is being drawn, is as part of a person's routine annual labs for their primary care physician, as just part of their screening for things, or in relation to issues that they might be having. But it's not just prostate cancer that an elevated PSA level could indicate. It can also indicate something called benign prostatic hypertrophy, BPH. And when we talk about BPH, its name tells you what it is. So it is benign, meaning that this is not a malignancy, right? This is not prostate cancer, but it is hypertrophy. So this is larger volume of growth than expected. So the prostate is bigger than expected, but it's not cancer. So this is a really important step in determining what's going on, is getting that PSA level. So let's say you have a patient who says, you know, I'm having some issues voiding, I'm having the feeling that I need to go, but I can't urinate, I'm having dribbling, I'm having hesitancy, you know, whatever the issue may be. And we draw that PSA level and it comes back elevated. Okay, all this does is tell us we need to investigate further. Now, one of the things I want to call your attention to here is a key point, that we always take a patient's PSA prior to performing a digital rectal exam. And when I say we, I mean we as like healthcare. That is not going to be in my scope as a registered nurse here in Ohio. I'm not investigating the size of anybody's prostate with a digital rectal exam. That's for the provider. But the point here being that we are not jumping to just doing the digital rectal exam every year or anything of that nature. Again, we always go least to most invasive, and so we're going to start with the PSA. That's going to be our least invasive way of checking out the prostate before moving on to a digital rectal exam. That may not have always been the guidance in the past, and that is why I'm bringing that to you now. All right, I'm so glad you stayed until the end, because I'm going to test your knowledge of a key fact I provided in this video using a quiz question. An elevated prostate-specific antigen, PSA, level may indicate the presence of which conditions? Benign prostatic hypertrophy or prostate cancer? All right, that is it for this video. I do hope you learned something. If you did, would you leave us a comment and let us know what it is that you learned? We really like seeing that. And hey, if you have a great way of remembering something that I didn't mention in this video, leave that as a comment too. We like to see it, but I know it's beneficial to other learners as well. All right, I'll see you in the next one. Thanks so much and happy studying.
We invite you to subscribe to our channel and share a link with your classmates and friends in nursing school. And if you found value in this video, be sure to hit that like button and let us know what you found to be particularly helpful.